What really happens to your vagina if you don't have sex for a long time? Have you ever wondered what happens to your vagina if you don't have sex for a long time? Does it become tighter? Does it close up? Can it forget how to function? There are so many myths out there, and today, we're clearing them up with real facts. Whether you're single, abstaining, healing, or just not sexually active right now, this video is for you. Let's talk about what actually happens to your body. Nothing closes up. Your vagina is not a door. First things first, your vagina does not close up if you don't have sex. The vagina is a muscular, elastic organ. It's designed to stretch and return to its normal shape, whether during sex, tampon use, or childbirth. If you stop having sex, it simply stays in its resting state. That's it. There's no sealing, no shrinking into nothing, no damage. Your body doesn't require sex to stay functional. 2. You may notice slight tightness at first. If someone hasn't had penetrative sex in a long time, they might notice mild tightness or discomfort the next time they do. But this isn't because the vagina closed. It's usually due to reduced relaxation anxiety, lower natural lubrication, pelvic floor muscle tension. The vaginal muscles can become a bit less accustomed to penetration, just like any muscle not used in a while. The good news, with relaxation, foreplay, and comfort, the body adjusts quickly. 3. Natural lubrication may change. Sexual activity increases blood flow to the vaginal tissues. When you're not sexually active for a long time, some women may notice slight dryness, less frequent arousal, reduced spontaneous lubrication, but this depends heavily on hormones, especially estrogen. Younger women usually won't notice major changes. However, women approaching menopause may experience more dryness, but that's hormone-related, not sex-related. And remember, arousal is about stimulation, not frequency. 4. Your libido might decrease or increase. This is interesting. For some people, not having sex for a long time can lower sexual desire. The body adapts and becomes less focused on sexual stimulation. For others, desire increases because of anticipation, curiosity, or hormonal cycles. There is no normal here. Libido is influenced by stress hormones, mental health, relationship status, overall health. So if your sex drive changes, that's not your vagina malfunctioning. It's your brain and hormones adjusting. 5. Pelvic floor muscles still matter. Even without sex, your pelvic floor muscles remain active. These muscles support the bladder, the uterus, the bowel. Sex is not required to keep them healthy. However, pelvic exercises like Kegels can help maintain tone, especially after childbirth or with aging. So your vaginal health depends more on muscle strength and hormones than on sexual frequency. 6. Emotional and psychological effects. Sometimes the biggest changes are not physical, they're emotional. If someone is avoiding sex due to trauma, stress, or relationship issues, they may experience anxiety during intimacy, fear of discomfort, emotional detachment from sexuality. But if abstinence is a personal choice, many women feel empowered, focused, emotionally stable, spiritually grounded. Your vagina does not suffer because you are not sexually active. Your mental and emotional health play a bigger role than people realize. 7. After menopause, a different conversation. Now this is important. After menopause, estrogen levels drop significantly. This can cause vaginal dryness, thinning of vaginal walls, reduced elasticity. If someone is not sexually active during this time, tissues may become slightly less flexible due to low estrogen, not because of lack of sex itself. In these cases, doctors may recommend vaginal moisturizers, lubricants, estrogen therapy, if appropriate. Again, hormones are the key factor. 8. So, is sex necessary for vaginal health? Short answer: no. Sex is not medically required to keep your vagina healthy. What actually keeps it healthy? Good hygiene, safe sexual practices if active, balanced hormones, regular gynecological checkups, pelvic floor strength, managing stress. That's what truly matters. So what really happens if you don't have sex for a long time? Physically, very little. Emotionally, it depends on the person. Hormones? They play the biggest role. Your body is smart. It adapts, it protects you. It doesn't punish you for being sexually inactive. Whether you're abstaining by choice, circumstance, healing, or personal belief, your vagina is completely okay. And remember, sexual health is about knowledge, confidence, and self-care.